Hi, and welcome to the Kiwi Ultrasound learning segment. This is a quick practical look at a topic in ultrasound, so I hope you enjoy it. Let's get on with the day's tip. Hi, welcome back. So this is a simulated segment here. We're going to show a metacarpal fracture. This is a common fracture you'll see in urgent care, emergency departments all over the place. So thanks Ben for simulating.
No worries.
Now, usual story, knocked against a solid surface, maybe a bad boxer's fracture, or sort of story, swollen over the metacarpal. And as I'm examining, I'm already putting on the gel. It's too sore to really examine much. I can check for rotational deformity. And I put the probe on as we're talking, and immediately you can see on the screen, you can see the metacarpal, you see the skin, soft tissue, and then the bone. Remember, you can't see in the bones, just reflection under there. You can see the line of the metacarpal, and we run distally to the end of the metacarpal, and if we straighten out the fingers, we'll see there's a metacarpal phalangeal joint there. We go back the other way and we see the carpo-metacarpal joint on the fifth. This is a longitudinal view, and this is the best one for seeing these sorts of fractures. You'll see them every time except in the faintest of hairline fractures. So here's an example. This is a shaft of a fifth metacarpal. Looks very much like a neck of fifth though. Just gives you an idea of where you can see the angle, where you can see the break, and you can just scroll through it in your longitudinal view. Just put these on every single metacarpal fracture you see, and before long you'll get the hang of it. So that's your fifth metacarpal fracture. Simple to see, and then simple to get on with the treatment.